Alrighty, welcome everyone, and thank you so much for joining us today. As a reminder, we do have you muted for the initial briefing, and once the initial briefing is finished, you can use the Zoom application to either raise your hand to ask a question, or you can type your questions into the chat box. And if you've called in by phone only, you can use *9 to let us know you want to raise your hand. That way we can unmute you to ask your question. In addition, please make sure to identify yourself by your full name and the organization or media outlet you are calling from prior to asking your question. And with that, I'll turn it over to County Manager Mike Callagy.
Thanks, Ellie, and thank all of you for joining us. Beautiful April 15th briefing. Beautiful day out there. Let me update you in regard to the cases confirmed. Monday, we were at 701, Tuesday at 721, and Wednesday at 747. So you can see about 20-something increase per day, and that really is a function of the testing capabilities. We could see that go higher if we were testing more people, and I'll talk a little bit about where we're at with that. We're still holding at 21 deaths. An update from the board yesterday in regard to health. The board, the chief of health talked about the national framing around strategies that would allow us to contemplate a change in the shelter in place. And really that is to build up our contact and tracing capacity. And that is something that we're focusing on right now to try to make sure that when that time comes, we do have that capacity. So if someone is positive, we can go back, trace who they were exposed to, and try to get those folks to quarantine in order to try to stop the spread. And that'll be critical when we do open at some point in time. And certainly Governor Newsom talked about that, and that certainly pertains locally. And in regard to what Governor Newsom was talking about yesterday, obviously all those things are true. And I just want to highlight what he indicated at one point is that really it's up to the local health officials. Though, he may have thoughts, the governor's office may have thoughts on reopening. It's really up to the individual health officials to determine when a county will start to loosen those shelter-in-place restrictions and start to re-engage society again. So we will keep you posted on that. But until we get there, and three things that we will look at, and the health officer will look at, and has indicated certainly in his recent message, were the 3 S's: the staffing, the space, and supplies. We've done outstanding on the space. As you can see, we've got 65% shelter in place, which is incredible, and reduced that line tremendously. And what it has done is it's prolonged that surge date to a point way out in the future. Potentially in the middle of summer or even late summer. So that is good, because what it's allowed us to do is, on the one side, build up the staffing, and that's where we're at now. I'll ask Ellie to go back and pull up some of these stats here, just to give you an idea. If we can pull up the one with the graph on it showing the surge space and ICU beds right there. As you can see, we're at 76 hospitalized right now for COVID-19. In the ICU beds, we've had 34% capacity. The ventilators, we've got 80% capacity. And in the surge beds, we've got 94% capacity. I mean, that's outstanding when you think about it. And that's, a credit to the men and women here every day who are working on building capacity. And that this time that we've been able to build in with the shelter in place has allowed us to build up that surge capacity and take some of those beds at the event center that we had, those 250 beds, and put them in hospitals so that we have the leverage of the staffing resources at the hospital there, that we don't have to move to the event center. And that's worked out well, and certainly bringing governor's office, bringing Seton online, additional beds there, has all played into this and really given us the time to prepare. So again, we want to thank everyone for their efforts in sheltering in place, and they're the ones who should get the credit for really driving down that peak period and stretching it out, allowing us to do this, to get these ventilators and beds in place. So we'll continue to monitor that, and the area that we still continue to struggle with is supplies. And again, this is an ever-changing front out there when you're dealing with supplies. The price keeps changing, the delivery cost keeps changing. It is certainly a supplier's market out there right now, and it's really kind of like the wild, wild west. And it is the going to the highest bidder, or who's willing to pay more over the asking price. So that remains an area that is difficult to manage. And though we do have supplies en route, we hope they get here. And when they get here, we hope they get them delivered to us. So we'll continue to monitor that. And that is that third S that we need to really feel secure about reopening society. As we got to make sure we have those PPEs when and if those numbers start to increase again. As I mentioned the other day, and I want to give you a little bit more specifics around it, the assisted living and care facilities in San Mateo County. This is a critical area for us, and I want to tell you why. We have 360 assisted living care facilities serving 6,000 people in this county. We are one of the fastest aging populations in the state of California. So we know that we have significant senior population here. On top of that, we have 17 skilled nursing facilities serving 1,600 more people. So we've got 7,600 folks either in assisted living care facilities or skilled nursing facilities, and these are the most vulnerable to COVID-19. So if we get a case in one of these facilities, it could quickly go through those facilities, infecting many, and obviously those are the ones we're most worried about, because you could see from the graph that we showed you earlier of the 21 deaths, those are the ones from 71 to over 90 that are really impacted by this. So that is a great cause of concern for us. So we are going to work on making sure that we use our resources, our doctors, and our medical team to go in there to help do the assessment that the state and feds do in some of these facilities, to do the assessments, to make sure that we're helping to train the staff, and to build their confidence in knowing that they can handle the situation through proper donning and doffing of the PPEs. Another area that we've got to really concentrate on is the testing inside these facilities. Not only those members that are there as clients, but certainly the staff. And that's something that we will be working with our partners to make a priority moving forward. The senior services, Ellie, if you can bring up the photo of this. So the Peninsula Healthcare District and Peninsula Family Service have partnered to provide people age 60 plus an easily accessible call line to support available and supported in available multiple languages. And this line really helps to ensure that our more senior residents stay connected to resources and services during this time of shelter in place. So we don't want them to feel isolated. Many of them do, but they can call on this line 650-780-7542 to talk to someone if they just feel like talking to someone, or to get valuable resources. So we thank our partners at Peninsula Healthcare District for doing that. Xenophobia, with the increase in incidents of microaggressions and racial profiling in Asian American and Pacific Island communities, the president of the board yesterday, President Slocum, appointed an ad hoc subcommittee comprised of Supervisor Pine and Supervisor Canepa, who will bring a resolution against xenophobia to the board for consideration next week. We also have resources that we're delivering and distributing to the cities and elected officials, so that they can use this as a resource for their constituents. So we have some of these flyers here that you can see that we're distributing. In addition to the prior ad hoc committee that I spoke about, two more ad hoc committees were formed yesterday, one with Supervisor Slocum and Horsley to focus on addressing inequities exposed by COVID-19. So we really want to reach every nook and cranny of San Mateo County to make sure that we are reaching all our community members, regardless of immigration status or language barriers or whatever it may be. We want to make sure that there's equal access and that they avail themselves of the resources available and they're informed about what's going on. And we will continue to work on that. So the board has formed a ad hoc subcommittee on that. And then additionally, Supervisor Horsley and Supervisor Groom are members of another ad hoc committee that is focused on the needs of our seniors and resources available to them. So we will continue to keep them updated. So COVID testing, we did have our first people use the transportation vehicle today. Thank you for getting the word out there. We just want to remind everybody that this service is available to them. We will go anywhere in the county to get them picked up and brought to a testing site so they can get tested. And that number again is 779-9375. I do want to highlight part of the outreach to the homeless population and some of the great work our volunteers have done. And Ellie, I don't know if you bring up that picture, but we do have volunteers who are giving masks to HSA so then we can distribute to those that are homeless. And of course, we're trying to get the homeless housed. We're looking at the potential of another 100 hotel rooms to get more of our homeless off the street, and those are the most vulnerable ones, so that we can either take them out of the shelter or off the street or out of different programs and house them in individual rooms where they are less exposed and can shelter in place. And we will free up space in the shelter by doing that. And then we can go out to some of these encampments and see if any of those folks would like to come in to the shelters and get out of that the living space that they're in right now in more of a congregate type of setting. We certainly can enforce and do enforce the specific standards of distancing in shelters. We can make sure that people are wearing masks and using proper hygiene and that type of thing. So we think it's a much better setting for those folks, and we will continue to work on that. So a couple of the questions that we've had for today. Yesterday, the question is that yesterday the governor provided more details on how he and his two gubernatorial counterparts on the West Coast intend to evaluate when their states might be ready to modify shelter in place. He cited the following 6 indicators that will be assessed before loosening. So, certainly those are things that we're all looking at, and really going back to those 3 S's, those are so important. That is so important to really take into consideration. But he did not offer a specific time frame. Again, it'll be up to the individual county officials to determine when that time and place will be. And certainly he indicated over the next few weeks, the administration will be closely monitoring hospitalizations and individuals in ICUs to see whether the numbers flatten or decline. That's a great indicator. As we indicated, we've got capacity, surge capacity built in. It is certainly heartening to see that we have that much surge capacity and ventilators available, though we still do have 66% of our ICU beds in use right now. And that, I'm not just saying that those are all COVID-19 patients, but we do have a variety of other medical emergencies in the county which also take up those beds. Are the testing numbers at the event center still low? Yes, and it's really a factor of the supply chain on these nasal pharynx Q-tip swabs. Yeah, that's what it is. Swabs. Thank you, Peter and Amy. The swabs that are just on a national and internationally short supply. So you can see here that Ellie pulled up the amount of people we've had tested now in the county, which is really kind of 1% of the county. And we'd love to see that dramatically increase, or even the serological testing for the antibodies, really ramp up. The nice thing about this, you can see that the turnaround time is coming down. We hope that we will get that down to 24 hours someday. That would be the goal. You can see that, it's kind of still hanging in there, that about 10% testing positive, but that's a very small sample set there, and certainly not reflective of I think the county as a whole, but just of this sample here. And as indicated, we believe that, or the health official believes that 15 to 25,000 maybe in the county are infected, had it, didn't know it, they were asymptomatic, or had minor symptoms and didn't know it, or certainly came before we started collecting data. So we will continue to monitor that, and really, I know that Verily would like to do more testing. They have the capability to do much more testing. Probably 500 to 1,000 a day at that one location. And if we had enough of these swabs, we could certainly look at other sites too. And obviously that takes infrastructure, but I know that there's resources out there that we'd probably look to, because we want to make sure that people have access, and that's the big thing right now. The testing criteria we talked about, it's really, I think the state's amenable. It's really the supply chain on the swabs. And then the next question, who is on the short-term and long-term working groups opening, and what are their specific goals? Really, it's a variety of people. I don't have the list in front of me. The goals really are to think about all the parameters that are involved in something like that. And you can understand there's a million different things to think about. What are the most essential services? How do you gradually restart a society? What are the best practices? Looking at other countries, what has worked there? What has not worked there? So it takes a lot of research. I indicated before, we do have a consultant on board, IEM, who we're working with to help us work with these groups, and they're doing certainly their own research and taking their own efforts to put a white paper together and put information together on this. And we look forward to their report and to the information that all the elected city managers and folks in these groups bring forward to us to consider when that time comes. And then again, the reason that really the underlying thing we got to look at is, again, those 3 S's: in the state, the staffing, space, and the supplies. And again, we have 2 of them, and the supplies are something that will be critical to reopen. If we open and we have that surge and we don't have the supplies necessary to protect those on the front line, we could end up like a situation in New York. We're putting the last thing we want to do is put the lives of our nurses, our doctors, those in the hospital, or our first responders on the line by having to deal with this. So we want to make sure that we can manage this in every way possible. And are there sufficient numbers of in-home support services workers? And the answer is yes, there are right now, those sufficient numbers. So with that, so that's the only questions I have. I don't know if Peter or Michelle or Amy want to add anything. No. Any questions?
And just as a reminder to everyone on the phone, you can click the participant icon in order to ask a question. It's at the bottom of your screen. When you click that icon, you'll see a window pop up, and in the bottom right-hand corner, there should be a button that's 3 little dots next to the mute button, where you can press, and you'll see an option to raise your hand to let us know that you'd like to be unmuted. And you can also type your questions directly into the chat box, and we'll read them aloud. But with that, we'll go to Henrietta. You've been unmuted.
Yes, thank you. Last week, I had asked how much the county was paying to house the emergency responders who lived out of the area. And I'm wondering if you have those figures yet. Maybe how many responders that we're talking about, and how much the county might ask in terms of reimbursement from FEMA.
Yeah, we're going to ask for complete reimbursement of everything. FEMA only pays up to 75%, but there's other ways to try to get the rest of the reimbursement. I don't have those numbers. And that's a good question, because I know we've secured those rooms. We only pay for them when we use them. in different hotels. But we'll try to get those numbers for you to find out now that we've been operating and have that up and running for a while, how many folks have taken advantage of that. Certainly we have the hotel rooms we're using for the medical staff that we brought in from the outside. That's part of their contract, so that wouldn't apply here. But I think what you're asking for is those locally here that are utilizing those hotel rooms and how much that cost is. And we will try to get that for you, Connie, if we can maybe have that for the next briefing. That'd be great.
Thank you.
Thank you, Henrietta. With that, just reminder, if there's any other questions, go ahead and you can press that participant icon and the window will pop up where you should be able to click the button next to the mute button on the right-hand side to raise your hand. You can also type your questions into the chat box. And I'm not seeing any other questions at this time.
Wonderful. Thank you all for participating. Go out and enjoy this beautiful day, but stay within 5 miles of your residence. So thanks so much, and we'll be back on for Friday.